All right, let's get more on all of this from Derya Unutmaz, who's an immunologist at the Jackson Laboratory. Derya, we really appreciate you being with us. I want to touch on some of the U.S. lines really quick. We heard the Trump administration giving their White House press briefing on the coronavirus task force. Trump says he's going to be looking at ways to reopen the U.S. economy after this 15-day guidance. He says that you can simultaneously watch the hot spots and reopen the national economy. Is that a bit concerning when you hear the New York City mayor talking about the number of cases there and the fact that hospitals could be running out of medical supplies in a week because even with the measures that we've seen in place, we're still seeing a spike in cases across the United States?
Yes, it's extremely concerning. I mean, this has been mismanaged from the very beginning. Mr. President tweeted just 2 weeks ago that this was nothing serious and not any worse than a flu infection. It is extremely serious. This is one of the most infectious viruses we've ever seen. It is deadly. And it's spreading like wildfire. We didn't notice it because there were not enough tests done early on. So now the test numbers have increased, and the positive cases are all over. Very serious.
One of the members on the White House coronavirus task force was saying that self-swabbing options may be available sometime over the next week. They've been looking at this anti-malaria drug combined with Zithromax, or a Z-Pak as we call it, as being a potential game changer in that. What is your assessment of both of those drugs being used to treat COVID-19? And do you think that that would change the way that the U.S. has handled the outbreak in comparison to other countries?
Frankly, I haven't seen any data that suggests that these two drug combinations could be a game changer. Chloroquine in particular, it's an anti-malaria drug. It does have some effect on the viral replication, and it's been used in China, in France. There was a report from France. It was a very small study, 20 people, and frankly, it wasn't a very good study. Right now, there are phase 3 trials ongoing in the U.S. and rest of the world. So we have to wait for those phase 3 trials to see if this really has an effect or not. Some patients might benefit. It's a drug that's available. So if in critical cases, it should be used, or this combination. But this is definitely not a breakthrough at this time. And I find that very, very puzzling that the president would say that. We have no evidence that these drugs are actually any effectiveness. We still need to wait for the data.
Absolutely. Derya, you're a medical expert, and I feel like I can target all the questions I want to in the world directed at medical experts. But in terms of what the public needs to know and what we need to know about not just the outbreak here in the United States, but the global pandemic in general, what would you like to add?
I think what I would like to add is that we have great examples where this virus can be controlled. China, probably one of the safest places to be right now, ironically. South Korea, Japan, Taiwan, Hong Kong, Singapore, all of these places, even though there's still some hotspots there, they have essentially controlled the virus. And the way they did it was with very strict quarantine rules. China forced 100 million people to be quarantined around Wuhan and in that region for almost 2 months. And now they have 0 cases from Wuhan for the last 5 days. South Korea did a fabulous job in doing a massive number of tests. They've done over 400,000 tests so far, and they've immediately isolated those who are positive before even they started to show symptoms, and they controlled it. And similarly, Taiwan did the same thing. Japan is a very interesting situation. They didn't really do a suppression there, but I think the Japanese culture knows to be very disciplined, and they really practice social distancing. So we have those examples. On the other side, we have the example of Iran and Italy, rest of Europe, and now U.S. So at the short term, there's really only one solution. Either you have to do complete suppression or a massive number of tests and immediately isolate those who are positive and quarantine those regions. There is no other way.
So if I could just, before we go, just get a number from you, how long do you think the U.S. should be in quarantine when you look at other countries like South Korea and China that have been successful at sort of flattening this curve?
Well, again, I mean, we have to look at what's going on as examples. Italy, if I remember correctly, they've been on lockdown since 3 weeks, and it looks like they've reached a sort of a peak. They're still reporting about 4,000 or 5,000 cases a day and about 600 dying. So it's clearly going to be more than 3 weeks for sure. China, as I said, they've actually done this almost 2 months. And even now, they're only slowly releasing people from their homes. So it's probably a month or maybe more. It's hard.
All
It's
right.
really hard to say
Derya
right now, but
Unutmaz.
it's not going to be short.
Yeah, exactly. Well, it doesn't appear that 15 days is going to be enough on that. Derya
No.
Unutmaz, we really appreciate your expertise. Thanks for being with us.